Greetings, everyone. I am Jennifer Renee Anthony. I also go by Reverend Jenfire Henderson or just Jenfire for my writing and my arts and crafts and other stuff that I do. And this is my diagnostic journey. And let me start off by saying that I am not a medical professional, and the information and links shared in this video are for informational purposes only and are not a substitute for professional medical advice. Since 2002, when I was just 22 years old, I've had an alleged muscle disease with an abrupt, sudden onset. When I say sudden and abrupt, I mean that this literally happened overnight. I went to bed fine and woke up severely disabled, unable to run, jump, get up from the floor, rise from sitting without pushing up with my hands, and then pushing on my thighs to straighten my torso. Couldn't throw a ball very far, couldn't go up steps normally, and eventually developed a waddling gait due to weakness in my hips and thighs. The first few years after onset, no doctors would take me seriously about how weak I was at the young age of 22. I'll be 44 this year in November of 2024. They told me to see a psychiatrist and never tested me for anything. By 2005, I had become pregnant with my first child, which, as you can imagine, heightened my concern for carrying a child whilst being so physically weak, and I was worried about how this would affect the development of my child, since what was going on with me was unknown. During my prenatal care visits, which were monthly, I expressed my concerns to the doctor who, once again, minimized the situation and basically avoided the conversation of discussing my severe muscle weakness. At this time, I didn't know the technical terms to describe my weakness, but now know that it's called proximal muscle weakness, which affect the hips, thighs, upper arms, and shoulders, those closest to the torso. I will come back to the discussion of my firstborn child here later in the video because it's important to my journey of discovery and diagnosis, but I will say that my daughter was born with severe low-functioning autism and was eventually diagnosed in 2009. I also had a second child born in 2009 who had an undiagnosed sensory processing disorder. In 2012, my family moved from Illinois to Tennessee. Upon arriving, I established myself and my children with new primary care providers. I knew there was a high probability that my concerns would continue to be completely ignored and or minimized, but I knew something was wrong and was determined to keep pushing until someone listened to me. I went to the appointment to see the new provider and pour my heart out. This time, the doctor finally took me seriously and ran a CK test, which is a creatine kinase test that measures the amount of creatine kinase in your blood. And elevated CK test levels indicate skeletal muscle, heart, or brain damage or degeneration. Within about 48 hours, she called me and told me to come to her office to discuss the results, which were highly elevated CK levels. I'm remembering probably around 1200 is what that level was at the time. She referred me to a rheumatologist in Henderson, Tennessee, who treated me for polymyositis using high-dose prednisone, but it did not improve, so therefore they ruled out polymyositis. I was then referred to a neurologist who conducted an electromyography in Jackson, Tennessee, and I also underwent a muscle biopsy of the left thigh and deep tissue MRI at Vanderbilt Medical Center in Nashville, Tennessee. By May of 2012, I was clinically diagnosed with limb-girdle muscular dystrophy, which is an inherited genetic muscle disease. This was a decade after original onset in 2002. I have no family history of muscular dystrophy on either side, going back hundreds of years. I did not believe that I had LGMD, but having the clinical diagnosis at least enabled me to acquire SSI benefits. Keep in mind that once diagnosed with LGMD and after doing extensive independent research on it, I stressed to all doctors that I did not believe I had an inherited genetic muscle disease, and that I believed it was an acquired myopathy caused by or triggered by something else. Of course, once again, no one listened to me. There is no cure or treatment for LGMD, and it was easier for them to slap me with a label and send me on my way. In 2014, after continuing my independent research, I came across the Jane Foundation, who is doing free genetic testing for the TTN gene, which tests for a type of genetic LGMD called titinopathy. The test results were inconclusive and VOUS, V-O-U-S, meaning variant of unknown significance. So, titinopathy was ruled out for me. From the original severe sudden onset in 2002, at age 22, until 2023, aged 43, my proximal muscle weakness was very slowly progressing for almost 22 years. Then, in August 2023, my disease started rapidly progressing to the point that it left me wheelchair-bound, unable to stand or walk by January, February, somewhere in there of 2024. From original onset to diagnosis took 10 years. That's from 2002 to 2012. I was clinically diagnosed with limb-girdle muscular dystrophy, which, as mentioned before, is a genetic inherited muscle disease. And I've always suspected that my experience was not very typical for limb-girdle muscular dystrophy, but haven't been able to get anyone to take me seriously that it could possibly be acquired. I've undergone all the genetic tests that can be done in order to get genetic confirmation of my clinical diagnosis of LGMD. The genetic testing that I've had recently in 2024 are a complete LGMD panel, comprehensive neuromuscular disease panel, whole exome and mitochondrial testing, and rare genome project. All tests have been negative, leaving me with no genetic confirmation for my LGMD diagnosis. I'd just like to add, too, that I find it ironic from birth to 22, I was fine. I had no sign of muscle weakness. I was in peak physical health throughout my entire childhood. Then at age 22, I had a sudden onset of severe proximal muscle weakness. And then 22 years later, after that, at almost age 44, I had another severe rapid progression, which left me completely wheelchair-bound. See the pattern here? First 22 years, fine. Sudden onset at age 22. Then 22 more years, fine, without any major progression. Then another severe progression at almost age 44. When the rapid progression started in August of 2023, I made an appointment with my local neurologist, Dr. Davies, here at Carle Foundation Hospital in Urbana, Illinois, who is the head of the MDA, Muscular Dystrophy Association. However, he doesn't actually specialize in any type of muscular dystrophy. He did agree with me that this recent rapid progression, and even my original sudden, abrupt, severe onset 22 years ago, was not typical of LGMD, and referred me to see specialists at Northwestern Memorial Hospital in Chicago, Illinois. During the months of October 2023 to January 2024, I was hospitalized several times for high CK levels as high as 4,600. On August 21st, 2024, I finally had my appointment with Northwestern Memorial Research Hospital in Chicago to see a team of specialists to review my case and see how they can help. After reviewing my case, they actually agreed with me that they don't believe I have LGMD. You can't even imagine how relieved I was to hear someone agree with me on this after believing I have a wrong diagnosis for 22 years. That said, they ran some blood tests on me because they thought that I might have some sort of autoimmune disease or something that triggered it. A few days later, they called me regarding the results of the ANA-test autoimmune panel and a specific test called anti-hmgcr myopathy. The ANA-test was positive with titer 160 and speckled. The autoimmune panel was all negative except C3 and C4. The results were positive for anti-hmgcr myopathy, and my level was 224.9, which is a necrotizing inflammatory autoimmune myopathy without statin exposure. That part's important because I haven't had exposure to statins, which is known to cause this anti-hmgcr, but many people, over half, do not have any known use of statins at all and still have it. And like I said, my levels were 224.9, which is a strongly positive test for that. And basically, it's a type of myositis where the immune system attacks the muscle tissue and can actually mimic limb-girdle muscular dystrophy. The great news here is that not only have we found out what's going on with me, but my new specialist team at Northwestern is hopeful that I'll be able to walk again with treatment. I may not be able to get back to full physical strength like I was before the original onset 22 years ago, but it is possible that I'll be able to stand and walk again like I was prior to the severe progression that happened over the last year, which left me wheelchair bound, as long as I don't have too much fatty infiltration of muscle. My doctor has started me on high-dose prednisone, and I will be having high-dose IVIG infusion every month. I will also have to undergo another muscle biopsy of my left arm bicep because the muscle biopsy I had in 2012 was too small of a sample and wasn't tested properly, according to Northwestern University or Memorial Hospital. However, I should add that they still don't know what the original trigger was back 22 years ago, but it was likely another autoimmune attack that was triggered by something unknown. I suspect it was from the flu shot I had or from a tick that was found on my hip, which triggered my immune system's attack on my muscle tissue. Because anybody that knows anything about Lyme disease, if you do get any kind of tick disease, it eludes the immune system by hiding in muscle tissue. So I can't prove that. That's just speculation, but now that we know that my immune system was triggered by something, I can only, guess that's what it was. I also suspect that my most recent rapid progression was the result of the COVID vaccine and boosters, but I have no proof of this either. However, there are studies that show those who have developed necrotizing myopathies after the COVID vaccine, even specifically the anti-hmgcr myopathy that I tested positive for. Links will be in the description. Now I'd like to return to the discussion regarding my child with autism, our blood type, and how this ties into the recent discovery of my condition being a myositis acquired myopathy instead of an inherited genetic muscle disease. First of all, I am blood type A Rh negative, and my daughter is also Rh negative. There is research suggesting that Rh negatives have a higher rate of developing autoimmune disease. There is also research showing that children born to Rh negative mothers are more likely to be born with ASD, autism spectrum disorders. That said, since we know that I have an autoimmune disease, which can be triggered or have flare-ups, I don't find it just a coincidence that on the day she was born, my white blood cell count was extremely high. Not only that, but as an Rh negative mother, I was supposed to receive a RhoGAM shot to prevent my immune system from attacking the fetus, but the RhoGAM was not administered correctly. Typically, the RhoGAM is given during 26 to 28 weeks of pregnancy and then directly after labor. In my case, RhoGAM was never given during pregnancy prenatal, and it was given just before delivery instead of after. These series of events, I believe, is what led to my immune system attacking the brain development of my unborn child, thus resulting in severe autism. In addition to this, about 6 months pregnant with my second child, I developed gallstones, which landed me in the ER at Carle Hospital back in 2009. There was a CK test done at that time that was elevated to 894, but doctors ignored it. That is the only time my CK had ever been tested until 2012 diagnostic testing for the LGMD done in Tennessee. Other than that, doctors refused to monitor my CK for 22 years, citing that I had LGMD and it wasn't necessary because it would not change that there is no cured treatment for LGMD. My CK wasn't tested again until my recent rapid progression in 2023, which was another decade later. In light of my new diagnosis of anti-hmgcr myopathy and the fact that there have been several patients misdiagnosed with LGMD, patients with a genetically confirmed muscular dystrophy do not have anti-hmgcr autoantibodies. I'll say that again. There are no known cases of people having anti-hmgcr myopathy who also have a genetic confirmation of muscular dystrophy. This is further proof that my original diagnosis was wrong. After undergoing all possible genetic testing available and testing negative for all of them, anti-hmgcr autoantibodies were detected in me at high levels. So, if you or someone you know has been diagnosed with limb-girdle muscular dystrophy and you have no genetic confirmation, ask your doctor to test you for anti-hmgcr myopathy, which mimics LGMD. Also, if you do have a clinical diagnosis with no genetic confirmation of muscular dystrophy, it is possible that the variant just has not been discovered yet. However, if you test positive for the anti-hmgcr autoantibodies like I did, then you do not have muscular dystrophy. Keep in mind that LGMD is a muscle disease. Anti-hmgcr is a type of myositis. LGMD is a problem with muscles themselves, as to where anti-hmgcr is when the immune system attacks your body. Specifically, it attacks the muscles. I will put all relevant links in the description of this video. In case I forget any important information or provide inaccurate information in this video, I will put the amendments in the comments section. And as mentioned earlier, I will also put all relevant links in the description for reference purposes. Alright, so now I'm going to talk about the treatment and recovery prognosis. The current course of action for treatment and prognosis on recovery for me are as follows. I am currently on high-dose prednisone, but doctors don't want me to be on this long term and plan to taper me off of it at some point in the near future. There are other alternatives to taking prednisone, such as methotrexate and rituximab, and I'm sure there are others, but I'm still learning, so take that with a grain of salt. I will also be starting high-dose IVIG infusions once a month in the coming weeks. I plan to make a video documentation of this process in order to educate viewers. The idea is to suppress the immune system to stop the attack on the body, clean the blood of the autoantibodies using the IVIG infusions, and lower CK levels. Depending on how long a person is went untreated will determine how much is recovered and restored. My current CK level is 1900, by the way. In my case, the most recent attack happened over the last year, which has a high chance of being reversed so that I can at least stand and walk again. I'm hopeful, but it's not guaranteed. It is unlikely that the damage from 22 years ago will be reversed because I was misdiagnosed for so long. IVIG treatment for patients with anti-hmgcr is required for long-term maintenance. From my understanding, once treatment has brought CK levels in normal range and the immune system is under control, supervised strength training and resistance training via physiotherapy should be done slowly and safely to regain strength. It could take months, or it could take years, or not at all. Like I said, the longer you go undiagnosed and untreated, the less chance of full or even partial recovery. This is largely due to fatty infiltration of muscles. Once that happens, new muscles can't rebuild or regenerate. It's not impossible though, and advances in science and medicine are always improving. I will make more videos regarding treatment and recovery once I know more, and also share updates on my progress. Right now, I'm just trying to take all this in and preparing myself for a fight for my life to get back to walking again. Please keep me in your thoughts and hope for a positive outcome. One thing I've never done is give up when everything is stacked against me. I'm proud of myself for continuing to advocate for myself and get down to the bottom of this. I want to give a special thanks to my friend Carol Abraham, who suggested that I get tested for the anti-hmgcr myopathy, and to Christine Airgood and Joanna Osborne, who have been amazing friends to me through all this. I really appreciate all of you who have been supportive and encouraging me to continue this fight, especially my Facebook feminist community as well. My support groups for LGMD and anti-hmgcr myopathy have been invaluable in this process as well. I don't know what I would have done without all of you. And of course, to my loving family, Ian, Wade, Jaden, and Dory, who have been by my side and believed in me when no one else did. My husband, Ian, has been and still is my caregiver to this day, and I dread to think what would have happened to me without his love and support. Words cannot express my gratitude for him. It hasn't been easy on any of us, and we don't know what the future holds, but at least we have each other.